America is growing older. The question is our healthcare system equipped to handle this aging population? Here's Rick Smith with more on that.
Heartbreaking article at the New York Times I came across today. Dave Lenhart has a piece titled "Big Profits in Caring for the Elderly," and it made me think about a friend of mine who, this is the salt of the earth guy. I mean, good, decent, honest, hardworking guy. Spent his entire life busting his butt to put some money aside to get to that golden moment of retirement, and recently had a stroke and a heart attack and a whole bunch of setbacks that really have changed his life irreparably. But now that he's in assisted living care, all of the wealth that he accumulated over his lifetime is evaporating, and quickly. This is not an uncommon story. Look, all of us know somebody who this has happened to, and sadly parents and loved ones, and it's going to get worse. Understand, this scenario of dying broke, this is going to happen to a lot of us because we just don't have the policies in place. I don't think we have the interest, sadly. You talk to individuals, and individuals are concerned about how are they going to take care of their parents, how are they going to take care of their loved ones. But as a matter of policy, this is bad. And the sad reality is we're a country that's getting older every day. We've all seen the statistics. You're going to have, what is it? What's the number? Like 10,000 people every day are going to turn 65 until 2030. And they're expected to live into their 80s and 90s. And look, understand, this long-term care that we've completely neglected, they say is going to reach about $500 billion a year in costs. And look, we haven't prepared for any of this. And the sad reality, I was thinking today about my friend. And, he's a guy who, like I said, he worked his entire life, busted his butt, saved as much as he could, lived very frugally, and, thought he was going to be able to enjoy the golden years with his significant other. But an ailment, something, nobody expected, has made him, unable to care for himself in his own home. And his significant other, she can't care for him. She's got problems of her own. So now he's in one of these facilities. $14,000 a month, I understand. $14,000 a month. Understand, no matter how much he saved during his working life, $14,000 a month? You're looking at over $160,000 a year. No matter how much you have saved, that's not going to last very long. Especially when you consider the sad reality, they tack on additional fees. So when I saw this Dave Lenhart piece, it made me think that, we're sorely ill prepared, especially with the fact that we spend so much on healthcare. According to his article, we spend about $13,000 per person in this country on healthcare, and we don't cover everyone. And everyone doesn't get equal treatment. But you stop and you think about $13,000 a year, a lot more than everyone else. Japan spends about $4,700 per person. Stop and think about the difference. And I know, but Rick, we get such better care. We get such better outcomes. Nonsense. Japan's life expectancy, 87.6 years. Us, at the bottom, 79.3 and falling. We spend more than every other industrialized country for healthcare. Everyone, without question, hands down, by a lot. The next closest, there's us at 13. The next closest is Germany at 7,400. We spend a lot more, and we don't get the improved outcomes. It used to be, understand, it used to be up until the 80s. The more you spent on healthcare, the better return you got. The more you invested in taking care of people, the longer they lived. The better policies you had, the better outcomes you got. And then something happened in 1980. something that took us away from this idea of investing in we the people, investing in infrastructure and, well, healthcare. Because remember, we used to have, I know it's hard to think about, we used to have community hospitals that were controlled by we the people, by the community. They weren't private for-profit interests, and they certainly weren't non-profit for-profit interests. They were for the good of we the people. Now we've got a healthcare industry. We don't have healthcare for and by we the people. We have an industry looking to make profit, lots of profit. And the caring for the elderly part is probably one of the more egregious, because these are the people who are the most vulnerable. And I look at my friend, who is now the most vulnerable he has been since he was a baby. And the system is screwing him over. The system is robbing him blind. He worked his entire life to build a little nest egg that he could retire on. And now, because of how our laws are, and because how we don't have regulatory oversight or policies to take care of folks in their most vulnerable state like this, he's going to die penniless. There will be nothing left. And congratulations, wealth class. You've figured out how to claw back the American dream. But what's frustrating in all of this is we know what the problems are. It's pretty simple. Healthcare is too expensive. We hear every politician talking about it. Healthcare is too expensive. I agree. Heard Ron DeSantis talk about it. Healthcare is too expensive. What are you going to do about it? How are you going to bring costs down? How are you going to bring competition back into an overly consolidated market? Because understand, this dying broke thing, only just beginning. The reality is we've got almost 1 million people living in some type of assisted living. And all of them are going to be broke. So the question becomes, in an environment with escalating costs, what do you do? How do we deal with a situation where we're getting older? We need policy, but in a Congress that can't seem to get out of its own way, in a Congress that seems to be all about, well, show and bread and circus. How do we come to actual policy? Again, I go back to, we already spend more than everyone. So it's not a matter of resources per se. It's a matter of allocation, is it not? Now understand, we spend less per capita, per GDP than everyone else. We spend less of our GDP on health than everyone else does. But we still spend a lot of money. 13 grand for every man, woman, and child in this country we spend on healthcare. Where does it go? And it goes back to the privatization. You see the privatization of hospitals. I remember, a decade or so ago, Dr. Bill Frist, senator from Tennessee, his family's worth $2 billion in healthcare facilities. They've bought up hospitals. When did healthcare become a for-profit industry? Now, I hear my right-wing friends say, well, we need to bring competition back. And you go, okay, what does that look like? When my daughter fell and broke her arm, do you think I had the local hospitals on speed dial? Do you think I was calling each and every one of them going, who's got a deal today on broken arms? You got to buy one, get one? Got a coupon in the local coupon clipper? Can I get a deal? If I pay with cash, do I get 10% off? Do you think I was doing that? No, of course not. Where's the closest hospital? Where's the closest place I can get my daughter the care that she needs? Because that's what healthcare is. If I'm lying on the ground having a heart attack, I'm not speed dialing looking for who's got the best valve deal. I'm not going on Groupon or halfoff.com to find a place that's going to get me cheap care. I want the closest, best care possible, the best people possible. That's what we should want as a society. But we've been sold on a whole lot of bad ideas. And a lot of them emanated out of the Reagan era. I remember community hospitals. I was born in a community hospital, funded by we the people, where we understood that that investment meant care for the community. When did we stop? And a big argument happened right around the Reagan era. When we stopped spending as much as the rest of the world per GDP on healthcare, and we decided something else. We were sold on the ideas that innovation was going to save us, and we spent a lot of money on innovation. That the free market would make things wonderful. And look, for some, understand, if you're one of the lucky folks at the top who can afford the best of the best of the best that we have to offer, yeah, you're going to do better. But if you're the working stiff like most of us are, you're going to not have the same outcomes. And I hear this all the time. Well, we can't have socialized medicine. They'll ration care. Have you tried getting an appointment to a doctor lately? Seems like a bit of rationing. But worse yet, we're spending all of this money and we're not getting the return on investment. We're not getting the money back. And that is through better health, longer lives. We need regulation. This is where you need government action to control some of the prices, because it's getting out of hand. It's getting crazy. And I think that my buddy who is in the most vulnerable moments of his life, and a system that only cares about, well, his bank account. How much can he put in? How much can we get out of him? And how long will it last? And the question is once that happens, once he's been drained of his resources, what then happens to him?